Hold up.
I hope you're having a great day. Today I want to talk about something that I call a silent pandemic. Something that has been silently affecting the lives of millions and millions of people across the world, of all age groups, senior citizens, young adults, teenagers, and even children. While the world focuses on acidity, we all think, because we keep hearing people talking about, I have acidity, I have acid reflux. So we look at stomach acid, or we look at acidity as something that's bad for you. Now, while stomach acid is necessary for human survival, and you're going to learn that today, too little stomach acid is a huge problem. And too much of stomach acid is also a huge problem. But in this world where we look for instant gratification, where we want quick fixes, we want pain to be taken care of immediately, we want relief immediately, we want our symptoms to be suppressed so that we can continue leading a poor lifestyle. For example, people know that they cannot eat certain foods, or they overeat, and when they overeat, they have acidity. But guess what? They're told to take an antacid, and they continue to eat those same heavy meals, never getting better. Now today we're going to understand what low stomach acid does to you and how it's connected with every possible condition that you possibly have or you may have. And why? Because number one, human survival at a cellular level, any condition, any disease is dependent on the kind of nutrition you eat, and moreover that, the kind of nutrition that gets absorbed into every single cell of the human body. So we eat food, it gets broken down in the stomach, enzymes, stomach acid, small intestine, absorption across your small intestinal wall, and your blood carries the nutrients from the food that you've eaten and broken down to trillions of cells in the human body. And the nutrition that your cells receive and the oxygen from the air that you breathe that your cells receive is what makes human health. And the basis of every disease, every single disease, the fundamental basis of every disease is based on your nutrition and your prana, which is your oxygen. And then, of course, there's medicine and everything else. When you have low stomach acid, you cannot absorb nutrients from the food that you eat. You cannot absorb minerals from the food that you eat. So you think you're eating healthy, or you think you're eating, but you're not really absorbing nutrition from the food that you've eaten, which contributes to several factors revolving around malnutrition. Malnutrition isn't a problem that's found below poverty line alone. Malnutrition is found in urban cities amongst educated classes across the country and across the world. Educated people and people who can afford good food don't know how to live the right lifestyle. And they think they're eating well, but yet they come every single day with malnutrition problems to doctors, nutritionists, coaches across the world. We're going to learn how to change that. Because whether you're struggling with hair problems today, cancer, skin, whatever it is related to your low stomach acid if you have low stomach acid. Okay, what is the function of stomach acid? Just so that we can honor it and respect it a little bit, because everyone, like I said, thinks stomach acid is something that we don't need and it's dangerous for us. Number one, stomach acid, like I said, is required for breaking down your proteins, your food, for better absorption of minerals and better absorption of nutrients. Protein. Tons of people out there just slugging down protein shakes, and yet they don't get bigger, they don't have more muscle growth. In fact, they have more cramping, they have more gas, they have more acidity, they're passing flatulence all the time. Why? It's a clear indicator that you don't have the right amount of stomach acid to break down protein, especially when you increase the amount of protein consumption that you may have to if you're trying to achieve certain body goals, if you're an athlete, if you're a bodybuilder, or you've been put on more protein by your doctor. But if you don't have stomach acid, the right levels of stomach acid, that protein is now going to become harmful for you. It's going to cause digestive issues, it's going to cause inflammation in your gut, and guess what? The function of the protein for which you put on will not be met. That protein will not work for you. So the first function of stomach acid is to break down your protein, your food, into minerals, vitamins, and make sure that the absorption happens in the small intestine. Second, you produce stomach acid when you eat to kill harmful bacteria, harmful pathogens, harmful germs, viruses that may enter your system through the food that you eat. So if you don't have the right amount of stomach acid, you will be that kind of person who constantly gets stomach infections, upset stomachs, and then you go to the doctor, you're put on antibiotics for the right reason, and you get put on antibiotics all the time, and you never wonder why your stomach is so weak, because you don't have stomach acid to break down and kill the viruses, bacteria, and germs that get into all of our systems. When we're traveling, we're eating. When we're eating on airplanes, when we're eating at home, there are so many chances that bacteria can get into our food, especially when we're eating raw food and raw salads and juices and all of that stuff. So if you don't have the right amount of stomach acid, you're going to have upset stomachs, and you're going to have, everything to do with bacterial infections and everything else. H. pylori. A lot of you would have heard of H. pylori. It can be extremely dangerous. H. pylori also thrives in environments in the stomach where the acid is less. It can survive in harsh environments in the stomach where there's a lot of acid, but this bacteria works better thriving when there's lesser stomach acid. So when you have lesser stomach acid, even an H. pylori bacteria can continue to do damage to your stomach wall linings, leading to gastric ulcers and a whole load of other problems. Okay, now let's talk about some of the symptoms. Now you will realize that a lot of symptoms are similar to when you have high stomach acid, acid reflux, and so-called acidity. So when you go to the doctor and you explain your symptoms, your doctor will rightly give you an antacid. The problem is, a lot of people continue taking these antacids every single day or whenever they continue to get acidity. Usually your doctor will prescribe it for a week or 2 weeks. Sometimes when you're on heavy medication, antibiotics, they may give you antacids for a longer period of time. But people have started misusing antacids because they don't want to change their lifestyle. They don't want to change the portions they eat. They don't want to stop eating junk. They don't want to stop eating, start eating slowly and chewing their food. They pop an antacid at every sign of discomfort. How does an antacid work? An antacid works on the principle of making your stomach produce less stomach acid. So do you see the vicious cycle that you create? Your antacid, your misuse, let me not say your antacid, let me say your misuse of antacids or your overuse of antacids is now actually creating your stomach to produce less stomach acid, which is leading to all of these problems, because by now you would have understood that you need stomach acid for survival and for optimum health. Let's see some of those symptoms. Upset stomach, low stomach acid. Acid reflux. You would think that only when you have too much of acid, you'll have acid reflux. Well, one of the symptoms of low stomach acid can also be acid reflux. Nausea, heartburn. Sometimes when you get that constant heartburn, low stomach acid. When you feel nauseous when you eat certain foods, or you pop a multivitamin or a particular vitamin and you feel nauseous after taking that vitamin, low stomach acid, because you need a decent amount of stomach acid to break down your vitamins and your minerals as well. Malnutrition. When you're constantly losing weight, you're eating well, everything's fine, your doctors have done all their tests and their scans, but you're constantly losing. Guess what? It's not about how much you eat, it's about how your body breaks down and absorbs what you eat. So when you're constantly losing weight, no, it's not always cancer. Everyone comes to me, hey Luke, I'm losing weight, am I getting cancer? No, it's malnutrition sometimes. You're not absorbing your nutrition the right way, you have low stomach acid. Bloating, constant bloating, low stomach acid. Iron deficiency, when your hemoglobin levels, when your iron levels are constantly low, you take supplements, they go up and then they come back down again. Low stomach acid. You need the right stomach acid for iron, to have the right amount of iron in your system as well. When you have a B12 deficiency, when you have calcium deficiencies, when you have magnesium deficiencies, again, low stomach acid. You could be eating a healthy diet that has iron, B12, calcium, and everything, but you have low stomach acid. Guess what? You're not absorbing it. You're not absorbing it. So then that leads to numbing. You feel numb, you're tingling in your fingers, you have pin-like sensations under your needle, under your feet, you have a blurry vision. There could be several other causes for that, like diabetes, peripheral neuropathy as well. But of course, low stomach acid also plays a role in that. So when you've tried everything and nothing's worked for you, you may want to look at low stomach acid. Skin issues. This is my favorite, because tons and tons of people keep going for more cosmetics and all. I don't have a problem with your skin cosmetics. I don't have a problem with skin doctors. I don't have any problem. But when you constantly continue to have skin problems, despite being hydrated, taking your meds, putting on your creams, low stomach acid leads to skin problems. Acne, darkening of the skin, pigmentation problems, all of these issues together. Osteoporosis. When you don't have the right amount of stomach acid, you have lower levels of calcium. Or if you have low levels of vitamin D3, you have lower levels of calcium, that too. So you start to have osteoporosis and you decrease your bone density. Leaky gut syndrome, okay? When you have inflammation in your gut, when you have low stomach acid, you have a leaky gut syndrome, which means that certain food particles which should have been digested and certain waste that should be passing out of your system now squeezes through your intestinal walls into your blood. And your immune system wakes up to attack it, leading to something called an autoimmune condition. So yes, low stomach acid is also related to every single autoimmune condition. Whether it's a multiple sclerosis, it's a systemic lupus, it's psoriasis, it's eczema, it's vitiligo, anything. It's a Hashimoto's thyroid, it's arthritis. Whatever autoimmune condition you have, you must consider looking at your levels of stomach acid through your lifestyle. Constipation, diarrhea, another symptom. When you see undigested pieces of food in your stool, it's a clear signal that the food that should have been digested in your stomach never got digested. And it's come all the way out of your rectum into your pot, and you see undigested food. You constantly have bad breath. You have weak hair, dull hair. You know, your hair doesn't look healthy no matter how much of shampoo you're using, how much of biotin you're taking. You still have a problem with weak hair, frizzy hair, dull looking hair. Low stomach acid, dry skin. You constantly have dry skin, again you have that problem. Hair loss, diabetes, cancer, asthma, allergies. When you constantly have allergies and food sensitivities, let's say you grew up and you could eat prawns, or you grew up and you could eat gluten, and all of a sudden you can't. You become insensitive to a particular food, or you start getting allergic to things that would never make you allergic. There's a huge clue, not just in the health of your liver, but low stomach acid levels. Because you need acid, the right amount of acid, to break down certain allergies that enter our system or that are caused by combinations of food or certain foods that do not get digested the right way. You tend to get more intolerant and insensitive towards certain foods, which you've eaten all of your life when you have low stomach acid. You have SIBO, that small intestinal bacterial overgrowth. SIBO is bloating again, gas, and all of these problems, dull skin. So you see, it's all interrelated. By now, I'm throwing all this information to you so that you can connect something in your mind. That while there are treatments for your symptoms, are you addressing the root cause of your problem? So let's get straight into solution mode. What can you do? Are there medicines and drugs that can produce more stomach acid? Absolutely yes, but let's talk about the natural things first. Another thing, when you're on constant antacids and even proton pump inhibitors, all of these things can also, asthmatic pumps can also lead to lower stomach acid levels. So if you have to take that, make sure that you're also changing your lifestyle and eating the right foods to stimulate stomach acid so that you don't have these symptoms. Now let's talk about the solutions. Number one, eat slowly and chew your food. The more you chew your food, the more stomach acid you produce. It's as simple as that. Right now, if I start producing saliva in my mouth and I swallow it, my system already thinks Luke's going to start eating, so I'll start to produce stomach acid. So chew your food. Number two, cut down on sugar, junk, and processed food. The more processed, the more junk, and the higher intake of white sugar and refined flours and white sugar, the lesser stomach acid you have. Zinc. Okay, if you have low levels of zinc in your body, you will have low stomach acid levels. If you have low levels of B vitamins, your whole spectrum of B vitamins, okay, you will have low stomach acid levels. If you're taking too many antacids and certain medications and drugs like beta blockers, you have NSAIDs, those are your painkillers over the counter. If you're on a bronchodilator, if you're on Valium, if you're on Demerol, certain medications which that your doctor prescribes you for your own good can cause low stomach acid levels. So you should always be aware of the medication that you're taking. Is it causing low stomach acid levels for you? Then you can do all of the natural things that I'm talking about, which is why it's so important for you to always address the root cause and always look at the side effects of your medicine and complement that with the right foods and the right lifestyle. So we spoke about eating slow, high sugar diet has to cut down, low levels of zinc, low levels of B vitamins. Allergies, if you have allergies, that's a great clue that you want to look at your stomach. Infections, if you're constantly getting infections and you're chronically sick all the time, you're chronically sick, you could be having levels of low stomach acid. If you're constantly tired all the time, you could be having levels of low stomach acid as well. Because if you have low level acids, you're not absorbing nutrients and minerals that give you energy. Okay, So chew your food, limit processed, fermented foods are great for you. Now, a lot of people cannot have fermented foods, and that's okay. That's also a sign that your gut is weak, and you need to strengthen your gut so that you can have fermented foods. So your kimchis, your sakra, your fermented foods, all of these things are great for stimulating stomach acid. Apple cider vinegar, fantastic to stimulate your stomach acid levels. So a tablespoon of a tablespoon of apple cider vinegar mixed in a nice mug of water. You can add a little bit of ginger powder. Fabulous concoction to stimulate your stomach acid levels. Take it about 30 minutes before your meals. Ginger. Ever seen the Japanese and some communities that live in the Far East? They give you a little bit of ginger before you start your main meal. Before sushi, you get that little, before you start your meal with sushi, you have those slivers of pink ginger. Why do you eat that ginger? Because it naturally stimulates your stomach acid that helps you to break down the meal that you're going to consume. In India, what do? We do onion, we do garlic, we sprinkle lemon over our salad. All these little nuggets of wisdom that we've learned from our ancestors stimulate natural stomach acid or gastric juices that help us with our digestion. And of course, if you're highly acidic and you have too much of acid, onion, garlic, lemon, apple cider vinegar can create the opposite problem for you. So if it suits you and you're able to do it, then you also know that you have low stomach acid levels. We have ginger. If you're hydrated, stay hydrated. If you're dehydrated, you will have low stomach acid levels automatically. Digestive enzymes. Sometimes when you have very, very severe cases of low stomach acid, your doctors or your nutritionists may give you digestive enzymes found in natural foods or in supplements. Now, your doctor can also give you something called an HCl betaine supplement. Okay, be very careful of this. It's available over the counter, it's available on Amazon, but you want to be very careful because you can stimulate too much of acid. And if you're a patient who has ulcers, that could be detrimental for you. And there's also the right way of taking an HCl betaine supplement and the wrong way. And then your prebiotics and probiotics. Your prebiotics are found in apples and bananas and cacao and onions and garlic and all of that stuff. And your probiotics are found in your fermented foods and your yogurts and all of that stuff. So you see, the basis comes down to low stomach acid level. You could have the most fanciest diet, but if you don't have the medium, which is stomach acid, to do the magic with the food that you eat, your foods actually become a waste. So this is what you need to understand. Low stomach acid level is a huge problem. I think 1 in 2 or 3 of our patients that we consult with every single day and over the last couple of years have issues of low stomach acid levels. Even though they come with the symptoms of high acidity levels, it is low stomach acid levels. And you want to correct this problem by changing your lifestyle. Have a great day, everyone. Until next time, eat smart, move more, sleep right, breathe deep, and remember, you care is all about you.